John, I had a great time talking with you about 7 big initiatives Amazon's doing in healthcare. What do we do next?
Ooh, how about 7 for Google?
That's only fair. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Hey, John, we're talking Google today. I think that's the company people have heard of. Let's talk about at least 7 things they're doing in healthcare.
Google in healthcare? Is there really anything to talk about?
There's a lot of things to talk about, John, and I know you know all about them. So let's start with the first one. $100 million, big money being put into what they call Amwell. What's that about?
Itsy bitsy money for Google. I mean, think about it. American Well is a fascinating telemedicine business that competes with Teladoc in selling to employers and health plans. It's surfing that wave of telemedicine that has blown up during the COVID epidemic. But as regulations have come down and people have gotten used to telemedicine, I think Amwell is going to do really well. But it's not just about the money, David. It's all about what they're going to be able to do. By Google investing in Amwell, they're going to be able to get the data, voice, transaction data, clinical, to give them really insights in one of the fastest growing new areas of healthcare, which is all of the different things we can do digitally via telemedicine. They're going to be using their edge in advanced analytics and artificial intelligence. I know you know a lot about artificial intelligence.
You got to get some kind out there, John. I'll take what I can get.
They really do have the best tools. And so anything that they can port onto their cloud, which is really their massive data warehousing capabilities, those data farms that drive all of your weird searches, David, but also create shared infrastructure that then you can do shared analytics on. If we could actually start to feed real-time healthcare information, imagine what we could do if Google could not just tell you could answer the questions you have, but maybe predict the problems or challenges you might have in healthcare and solve them.
All right, John, that sounds exciting. I think that this $100 million, like you say, is sort of chump change, and really it's sort of getting somebody to come over from AWS, which is Amazon, over to Google Cloud. So I like this artificial intelligence, like fake intelligence. But let's move on to number 2, John, and we'll never be done. Google Cloud more broadly. Google Cloud, is it anything, or is it just like a weak sister of the AWS and Azure?
I mean, you're skeptic. When are you going to find a technology you can admire and enjoy? Google is doing the right thing by putting up a real alternative. Probably after Microsoft, the cloud stuff will as software will take over the world, so will cloud, or kind of sort of non-on-premise computing take over computing. It's so much cheaper, and it can be so much more flexible, and you can get access to more tools. In terms of cost and speed and accessibility, Amazon Web Services and Microsoft Azure have an edge. But in terms of pure computational brains and brainiacs, Google's got the edge.
Right.
And I think that they're playing in the cloud sweepstakes, not just because they want to provide a different business line, but I think over time, all the investments they've made in analytics, very few of which have been used in healthcare, could actually be pretty interesting. So I'm intrigued by more healthcare providers leveraging the cloud. I mean, look at all the names. I mean, look at who's already chosen Google.
Yeah, so I mean, you got Mayo Clinic, you've got Ascension. A lot of times this cloud thing is hard to understand, except, sitting here on the East Coast, I'm looking out up in the sky and I see these clouds, dark clouds, which are from all the fires burning out from Google land and from Amazon land coming over here. I mean, they're using, Mayo Clinic, Ascension, they're doing AI for cancer diagnosis with the cloud. Although there's some concerns, John, like this Project Nightingale, where they're going to get your data and my data. So the cloud is a big thing. What do you got for number 3, John? Come on.
Stop. I mean, the Project Nightingale sounded like Project Nightmare because it was poorly positioned when they explained that they're going to take healthcare information and do things with it. And I think they bungled the explanation. But Google does have a big commitment to internet privacy and a big commitment to healthcare privacy. They wouldn't have gotten Mayo Clinic's business and others if they weren't really serious about protecting people's PHI. One thing I'm a little bit more skeptical of, but intrigued by, is this coefficient insurance. I mean, who's not going to love the name of a company, Coefficient Insurance? I mean, for all the math geeks in the crowd, I mean, you probably like it.
Well, John, the coefficient, if I recall correctly, that's that other letter I put next to the X. I think that's as much as I can recall about it. So what they're doing there is that they're working with Swiss Re on this. Swiss Re is some big Swiss company that does reinsurance. It's not good enough to do insurance, but they basically have this stop loss insurance for self-funded employers. So when employers are paying for healthcare themselves, when there's a really big claim, they still have insurance for that. That market's really inefficient. And the idea here is that with Coefficient and Google together, they're going to be able to make it more optimized and sell better insurance.
Let's be honest. This whole coefficient insurance is simply a way to insert Google's, again, analytics into an inefficient market. What stop loss payments are for employers, that's when an employee gets a big claim that's unpredictable. And so you pay for that. Like we at CareCentrix would pay not just our regular insurance, but we will self-insure, thereby paying for our employees' claims. And in case someone gets really sick, like a hemophiliac, where it could be millions and millions of dollars, and you want to provide that coverage, that's when insurance companies like a Swiss reinsurance would come in. I actually think it's a pretty cool idea. Again, this to me is Google, through its Verily subsidiary, being pretty smart about, like, maybe if we get the math right, we can take the risk down and the rates will come down. I think that's pretty cool.
All right, that's pretty good, John. Now, here's the thing. This is not like a specific initiative, but Google hires a lot of people, and I think they've done some serious hiring in the healthcare space. Anybody you would point out in particular as being important and impressive?
Well, I think that they've done some great hires. I mean, Dr. Toby Cosgrove, the former CEO of the Cleveland Clinic, one of probably the most successful heart hospital in the world, is an advisor to Google Cloud. Dr. David Feinberg, who was the path-breaking CEO of Geisinger, which led in the area of the Geisinger Clinic in Pennsylvania, led in terms of money-back guarantees for heart procedures, and also took a very different and engaged view of the customer, or as the patient as customer. And then Karen DeSalvo, who was the chief health officer, who was the ONCHIT, which is the HHS person, executive in charge of all the healthcare technology. So I think they're smartly trying to build out beyond the math wizards, geeks, and computer scientists and intelligent artificial types that they've got, to bring in proven healthcare talent. But this is going to be a process of discovery, because I do think that the culture of healthcare, which is more conservative and backward looking and careful, and the run and gun, try everything new tomorrow, or why not tomorrow then today technology approach, it's going to be hard to match those cultures. So I think it's smart to hire leaders who can sort of gap that cultural divide.
John, it shows you something about just the scale of Google, that a guy like David Feinberg, who you and I really look up to as running a real big healthcare organization, he reports in, not to the CEO of Google, but to the AI chief. So it's just gives you a sense of just how big the organization is and how serious their ambitions are. And John, speaking about Google, I know you didn't think they do it in healthcare, but I'm going to do number 5. It's kind of an obvious one, but you know what they're doing? Search. That's number 5, search. They're doing a lot of stuff in search, John. If you type, hold on. If you type in COVID testing near me, you'll see it integrated with their maps, and it'll tell you where the sites are, if you need an appointment, if you need a referral, if you need to be symptomatic to be tested. And then, a big thing is, John, is provider directories. Hard to get accurate information about doctors. They've already got stuff where they're treating it sort of like a small business. They've got their name, their address, they're adding reviews, answered questions. Love to see them add stuff like, what insurance people take. That would be nice.
David, this is all kind of obvious stuff. I mean, you are kind of the representative of the Department of Obvious, but really, obviously Google can search. What's new about this?
Yeah, Joe Sixpack, John, you can go ahead and say it. Is that guy still around? It's probably now with the diet down to Joe 4-pack. But Yeah, none of this is new stuff, John. If you go and you search on there and you can actually see like useful stuff coming up about COVID testing, of course that's new. And the provider directory, yeah, that's new stuff too. It is new.
Right.
Hey,
Everybody gets a provider
yeah,
directory.
they're all wrong as well. So these are getting to be more right. So I think it's good. All right, you don't like that one? Fine, fine. All
Boring.
right, how about this? Here's a little more techie one for you. Number 6, they have these exposure notification tools, and they're working with guess who? Apple, the fruit company.
What could I mean, they're going to tell me whether I've got COVID? Like, what's up with that?
They're going to tell you if you've come near somebody with COVID. They're going to use some tools, and they're going to have and it's not even an app. I don't think you just basically just like have it, on your Android phone. It's just going to pop up if you're like in danger, or if you've been in touch with somebody who's got COVID, and you're going to be. It's helping with the contact tracing. John, come on.
So, David, let me track this. You're saying Google's going to work with Apple to send notifications to my Android?
You even have a phone, John.
Don't you think that's kind of creepy from a privacy perspective?
Absolutely. I think it's very unclear about what the uptake will be. I mean, the good thing is you have your phone with you. The bad thing is you may not want to be telling Google what you're doing with COVID.
Wait a second. I thought you were in favor of this COVID exposure thing, and you mixed up the whole Android iPhone thing, and they do differ. Now, are you in favor of this COVID tracking or not?
I'm in favor of contact tracing. I don't know that it's going to work that well with these tools with the phone, because I'd be concerned about providing my data. But I'm open-minded about it, John. I guess if the government's not going to run contact tracing, why don't leave it to Google along with everything else?
I guess that's right. I mean, I do think that every other Western country and some of the Eastern countries have really gotten testing and tracing right. If this could help for tracing, I guess that'd be helpful. But David, what about this whole interoperability thing? Now, there's a really fun, easy to understand topic. What's the point and how important is it?
Well, John, I guess this will be our lucky 7, interoperability. There's problem with healthcare is that there's a lot of data, but it's siloed in all these different places. Google's actually tried to deal with this in the past. I remember years ago, they would bring into Google Health this data that you might have on, like in Beth Israel, patient data. You'd bring it in. The problem is it would bring it in, and if you had a test for the kidney failure, even if it was negative, it might show you had kidney failure. So they abandoned that whole program. But now interoperability is coming back, and it's partly because the federal government's actually been doing something on interoperability to enable data sharing between providers, between payers, to the benefit of the patient. And Google should be able to ride on that.
They're not asking, they're telling people, everything has to be interoperable. And don't you think that's going to help Google?
Yeah, I think it will help Google, because now Google's going to be able to get that data, and then it's a matter of just bringing it in. Imagine, John, if you're in Gmail, which everybody uses, and then if you go and look, instead of like Google Docs or Google Spreadsheet, you've got another thing, which is Google Healthcare, and you can go there and get all your information on your healthcare just the same way. I think that is kind of where we're heading. Again, it raises privacy concerns. People may not want advertising on that, but I think this is actually potentially a sleeper. They could wake up into something super big.
It's a big deal. I agree.
So, John, there's probably a bunch of other things that Google's doing in health, but that's 7. I don't think it would be fair to give them more things than we gave Amazon. So what do you say we call it a day?
I think we wrap it.
All right, John. Well, that's it for another edition of CareTalk. We've been talking about Google and 7 things they've done in healthcare. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.